COVID-19 cases here in Springfield slightly on the rise, but they're not as high as what Springfield officials had projected last week.
However, they say the numbers are still a concern. Western Mass News reporter Leon Purvis joins us live in studio with more. Leon?
Mary, Chris, last Friday, officials told me they expected cases to be more than 200 from the previous weeks. The latest data, cases are up by 127.
The numbers, as I was projecting, I had expected there to be over 200. However, it is less than that, which is good news.
Springfield Health and Human Services Commissioner Dalton Harris tells Western Mass News that the recent COVID-19 data is better news than she thought, but she is still concerned. Let's take a look at the most recent numbers. From the start of June to mid-June, cases were on a downward trend. But then last week, a spike in cases, 264 from the week of July 3rd to 391 the week of July 10th. That's an increase of 127 cases. Is an indoor mask mandate off the table for Springfield?
The city of Springfield does not anticipate going to an indoor mask mandate. However, we continue to ask our residents to be vigilant.
Springfield residents like Miguel Roman are still slightly worried about COVID. He still wears a mask when going into indoor public places.
When it first came out, people were dropping like flies. And I could say I was scared, yes. But now things are more under control. I'm not as scared as I was. I'm still nervous about it.
For Karen Hall, she mentions the virus is still in the air.
It's still not clear, and people are still getting affected by it. There's still symptoms going around, and now they come out with this new shot to take, and every shot everybody's taking is still not curing it. We're still getting it.
Dalton Harris's advice is to be aware of your health circumstances because no one is safe.
I want to get the message that everyone is at risk for COVID and that there is no age group that is not vulnerable to this particular virus. So everybody's at risk. Everybody protect yourself. That's critical.
Dalton Harris also adds that getting your COVID-19 vaccines, wearing a mask when needed, and washing your hands also play a part in staying COVID-free. Live in studio, Leon Purvis, Western Mass News.
Leon, thank you.